my name is Christy Metz. Imagine having to watch everything you put into your body. Not only what you put into your body, but the amount. If you fail to do this, there is a high chance that you may die. Constantly pricking yourself for blood to test your sugar level. Every day worrying about what your body will react to depending on what you eat. Diabetes is a very common disease. Diabetes is ranked 6th for the most common disease in the United States. Even if it does not affect you personally, I am sure you know somebody that is diagnosed as a diabetic. For the past 13 years of my life, I have seen my best friend and my grandfather suffer from this disease. Between the blood, the needles, going to dialysis several times a week, and the great amount of medication they have to take for diabetes breaks my heart. If you have a first-degree relative who has type 2 diabetes, your risk of developing the disease is about 40%. According to the American Diabetes Association, diabetes can lead to serious complications such as heart disease or stroke. The risk for stroke is 2 to 4 times higher for people who have diabetes. Diabetes is the 5th deadliest disease in the United States. I would like to take the time to give you a better understanding about diabetes. I would also like to explain the different types of diabetes and the process of treating those who are affected with this disease. First, I would like to explain exactly what diabetes is. Diabetes is a defect in the body's ability to convert glucose, sugar, to energy. In a healthy body, the sugar that is consumed is broken down into a simple sugar. The simple sugar is called glucose. Glucose is carried to your body cells, which go through the bloodstream to provide your body with the energy it needs to get through the day. Insulin is a hormone produced by your pancreas. Insulin helps regulate and move glucose into the millions of cells in your body. Basically, if you have diabetes, either your body cells are unable to recognize the insulin that the pancreas produces, or your body is unable to produce enough insulin. This is why a diabetic's blood pressure is usually higher than normal. By definition, diabetes is having a blood glucose level of 126 milligrams per deciliter. If diabetes is not taken care of properly, it can lead to death at an early age. Since you have an understanding of what diabetes is, I would like to take the time to explain to you the 3 different types of diabetes. First, there's type 1 diabetes. Type 1 diabetes usually affects children, but can also develop in adults as well. Type 1 diabetes occurs when autoimmune processes destroy the pancreatic beta cells that synthesize insulin, causing nearly a complete absence of this hormone, requiring patients to take daily insulin injections. The immune system then attacks the beta cells, which causes the cells to die. Therefore, blood sugar level rises. Type 1 diabetes accounts for about 5 to 10% of all diabetic cases. The second major type of diabetes is type 2 diabetes. Type 2 diabetes is developed when the body does not produce enough insulin, or the body is ignoring the insulin that is being produced. Therefore, the glucose builds up in the blood instead of entering the body cells, causing the cells not to function properly. The most common type of diabetes is type 2. Type 2 diabetes accounts for about 90 to 95% of all cases. The third major type of diabetes is gestational diabetes. Gestational diabetes is a type of diabetes that women develop when they are pregnant. Between 2 to 10% of expecting mothers develop this condition. When a woman is pregnant, hormonal changes can make your cells less responsive to insulin. Gestational diabetes is when your body is unable to use the glucose for energy, causing your blood sugar to rise. In order to take care of diabetes, you must make sure you are receiving the proper treatment. There are different types of treatment for each type of diabetes. Those with type 1 diabetes must inject or pump insulin into their body in order to survive. People who have type 2 diabetes control their blood sugar by exercising daily, staying on a healthy diet, losing weight when necessary, and taking oral medication. All in all, diabetes is a crucial disease. According to the Global Diabetes Walk, each year another 6 million people develop diabetes. If you plan on living a long, healthy life, the time is now. Take care of your body, and your body will take care of you. Thank you.